You are listening to Middle East Monitor Conversations, bringing you lively discussions with prominent voices from the region and beyond, as we delve deeper into issues shaping the Middle East and North Africa, from politics to culture and the arts.
Hello, everyone. Welcome to another week of MEMO in Conversation. I am Anjuman Rahman, a reporter at Middle East Monitor, and today I have with me Alex Saieh, the head of humanitarian policy and advocacy at Save the Children International. Thank you, Alex, for taking the time to join us and going ahead with the discussion regarding the suffering of Palestinian children in Gaza today. So thank you.
Thank you for having me.
Okay, so something we should all have marked on our calendars is the fact that Friday, 5th of April, we're marking Palestinian Child's Day. So therefore, MEMO felt it would be timely to have this discussion, considering the worsening situations on the ground in Gaza right now. One dire example is the horrifying images of malnourished children at which we're all scrolling on our phones and it's flooding our phones. We can literally see the outlines of rib cages and bones through their paper thin skin. And it's vividly clear that these children, these babies are fighting for their life. They're being starved to death. And that if nothing is done very soon, they could die from starvation. There are reports warning us that famine is imminent in the northern Gaza, and it is expected to occur anytime between now and May. And to be frank, we can see that right now with alongside the rest of the many horrific evil Israel is imposing against the Palestinian children. These haunting images, and we're also seeing viral video clips of Palestinian parents, the fathers feeding their starving children spoiled potatoes or grass and mixing all sorts of things due to the Israeli blockade imposed on the entry of food aid on the besieged Gaza Strip. In fact, based on the stats I have with me from Care International, is that at least 27 individuals, 23 of those being children, have already died from severe acute malnutrition and dehydration in the northern Gaza, with the youngest child being only a few days old. And Alex, I've also been looking at the reports from Save the Children that highlight the dire situation faced by the malnourished children due to obstruction of food and medical care, leading to weight loss, weaknesses, and details such as cracked skin. So, Alex, maybe you can begin by, introducing a little about yourself, Save the Children, and maybe provide an overview of the current situation regarding the malnourished children in Gaza. What specific challenges the children are facing, including their families, because we're also aware of the pregnant women as well. So there's children coming, more babies being born into this war, and the families that are facing difficulties in accessing food and medical care, and how Save the Children been responding to this crisis, and what specific assistance you've been providing to these affected children and families.
Thank you so much for having me. So Save the Children has been in the occupied Palestinian territory since the 50s, and we've been in Gaza since the 70s. So we have a long history of working with Palestinian children inside the occupied Palestinian territory, but also in the region. So we also work with Palestinian refugee children in Lebanon, Jordan, and other countries as well. So we have been working with them for quite some time. As you noted, the situation for Palestinian children this year is the most horrific situation they've ever faced. On record, we've seen more Palestinian children killed than any year on record, and we're seeing Palestinian children killed in the most horrific ways possible. To speak a little bit about the starvation that they're facing and the malnourishment, you mentioned that 23 children have been recorded to have died of malnutrition. We actually believe that in reality, this is just the tip of the iceberg. These are the children who managed to actually whose parents actually managed to bring them to health facilities and to try to get some help, and who have been recorded. But in reality, there's likely many more children who have died of combination of malnutrition and disease who we may never hear about. One of my colleagues a couple of weeks ago, when he was at one of the hospitals in Gaza, said that doctors said that after delivering babies, the doctors have to discharge the mother and the child immediately because they don't have the capacity to support them. And then the children, the babies, the infants just go back to the shelters and die because the mother is not able to feed her child because of the unsanitary and overcrowded conditions in shelters. And so these numbers are just the tip of the iceberg. And oftentimes when children are malnourished, they don't just die of the malnourishment itself, but actually of disease. And because their bodies are unable to fight off disease. When children face severe acute malnutrition, they're at higher risk of dying of common diseases like diarrhea or pneumonia. And malnutrition, especially when it's acute, it impacts children both in the short term and long term. Their muscles waste away. It can impact their cognitive and physical abilities. It can lead to stunting. So the physical harm that we're seeing imposed on Palestinian children today will mean physical harm in the long term as well. This is something that we really need to keep in mind. In terms of the looming famine in Gaza right now, another important thing to note is that in most cases, children and adults die of malnutrition way before famine is declared. Actually, when organizations declare or states declare famine, people are already dying of severe malnutrition and disease. And that's exactly what we're seeing now. So famine may as well be in Gaza right now because we're already seeing people dying. We're already seeing some of the horrific impact of prolonged malnutrition on children and adults as well.
And so what are the staff of Save the Children doing currently on the grounds dealing with this? Like you said, you can't declare famine. Famine is declared too late, I'd say. We see the results of it way beforehand. Children are dying. Like you said, it's not just the stats are probably much higher because it's not. We're obviously documenting what staff are seeing visibly and taken to them, the patients taken, but there are countless. I mean, there's rubbles, there's people still stuck under rubble and children's left abandoned under the rubbles because there's no access to them, and so they're dying from starvation under the rubble. Technically, they might not have been broken to bits. If they're not broken to bits and stuck under the rubble, they're dying from starvation under the rubble. So I'm glad you pointed that out. So can you give a little insight of what the staff are doing right now? Is it just are they being able to provide any food? And if it's not just providing food, like you said, there's other long-term damages. There's the mental health. So could you maybe give an insight to some of that, please?
Yeah, I think it's a really good question. And I think one thing to start off with is the conditions to provide meaningful humanitarian assistance in Gaza are not present. They're not present. And, Save the Children has worked in horrific contexts, facing, incredible challenges, incredible limitations. We have seen nothing like what we're seeing in Gaza. What Save the Children staff have, and honestly, it's not that different from most organizations, we're able to somewhat operate in Rafah. Rafah is where the majority of Palestinians in Gaza are currently sheltering. 1.3 million people, more than 610,000 children are in the tiny area of Rafah. And we have been doing our best to provide the basics: water, food, hygiene kits that include things to maintain sanitation conditions. But it's nowhere near enough. And we're facing immense challenges, again, just like every other organization. One, we're not able to get the items that we need at the pace needed through the crossing points through Rafah and through Kerem Shalom or Kerem Abu Salem. The items, first of all, we know that the Israeli inspections are taking way too long. In many cases, the Israeli authorities are denying entry to essential items. We have seen humanitarian organizations have things like water purification devices, poles for tents, scissors, medical scissors, essential items that, any population would need to survive, and that is essential to provide a meaningful humanitarian response. So that's the first thing. The second thing is that there are many more crossing points that can be opened in Gaza to allow aid into the areas most in need. So there are many crossing points bordering Gaza. Currently, only 2 really have been made available, Rafah and Kerem Shalom. We're not really able to access the north. And we know how horrific things are in northern Gaza. Some 300,000 people, possibly more, are in northern Gaza facing the highest levels of starvation. IPC5 is what the preeminent body on food insecurity is saying, right? And I think what's important to note is that when people are in IPC5 levels of catastrophic food insecurity, in many cases, they can't just have food. They need medical attention, therapeutic feeding in order to survive. And so it's not sufficient to just send truckloads of food to northern Gaza and, just like that. What we need is actual humanitarian access with professional, medical professionals, doctors, nurses, humanitarian staff with, extensive experience and the conditions to provide aid, including medical support, safely. That's not happening right now. And this is not only happening because many humanitarian missions to northern Gaza have been denied by the Israeli authorities, but it's also happening because organizations are not able to deliver humanitarian assistance safely. We saw the horrific tragedy that happened with 7 staff members from World Central Kitchen, but we know that some 196 aid workers have been killed in the last 6 months. And we also know that many other healthcare workers, doctors, nurses, ambulance workers have also been killed. And it's important to note that there is a system that should be in place to allow humanitarian aid workers to provide aid safely in Gaza, and that's not happening, right? Even when aid organizations provide the coordinates of their operations to the Israeli authorities to protect their movement across Gaza, we're seeing aid workers be killed. And this is primarily what's making it unsafe to deliver humanitarian assistance in Gaza. And this is having a massive detrimental impact on the population in northern Gaza, but also in southern Gaza as well. We're also seeing catastrophic levels of food insecurity in other parts of Gaza. And this is really the crux of the issue.
Okay, yeah. I read the report and it mentioned the attacks on the aid workers and, the obstructions in aid delivery. And, we're currently seeing the aftermath of the recent attacks, especially the 3 days ago on the World Central Kitchen. And as a result, aid trucks are turning away now, and organizations like UNRWA are pulling out because of the major safety risks on its workers. Where does Save the Children stand on this?
Well, we have condemned the use of starvation as a weapon of war. And alongside several other organizations and human rights organizations, we've seen the weaponization of aid in Gaza, and this must be stopped. We've called on Israel to lift all restrictions impeding safe aid delivery. And we've also called on the international community and donor governments to use their influence to stop this. What we're seeing in Gaza is setting dangerous precedents for other countries as well. And it's completely unacceptable. And we've we've not only called for a ceasefire and said that a ceasefire is what's needed to deliver aid safely, and protect and save lives, but we've also asked governments to stop fueling the crisis through the transfer of weapons, ammunition, and parts. And this is the moment where we need governments to face the facts and make decisions that could save lives in Gaza.
And looking ahead, practically, what role can governments and humanitarian organizations play in ensuring the protection and well-being of vulnerable populations, especially when it comes to the children and the pregnant mothers? Nothing is being hidden from us. We're seeing visually testimonies, first-hand testimonies, including, from Save the Children, where directly they're talking about the children, which I'd like you to share some as well, if you can, share some personal insight, give a personal touch to this discussion of how these children are feeling, what they're doing, how they're looking, what they're suffering exactly, the names, the age, giving some sort of imagery to these stats, I guess. And also, sorry, to finish off my questions, looking ahead, what are the long-term implications of the malnutrition crisis in Gaza, and how is Save the Children planning to address these issues? Because it's not even a 5 to 10 year long-term plan, is it? It's such drastic measures have been taken, therefore drastic results need to be responded with, isn't it?
Exactly. Well, so there's several things here. There's a few very straightforward things that governments can do to address the situation and what they should not be doing. The first is, and I think this most straightforward is they need to provide the funding for a humanitarian response, a meaningful humanitarian response. That not only means providing humanitarian, funding to humanitarian organizations, including Palestinian organizations on the ground doing the difficult work, but it also means not doing things that would affect the overall viability of a humanitarian response. So we need them to return to funding UNRWA. We've been very clear that no organization can replace UNRWA. Not a UN agency, not an NGO, nobody. They play a very special role in Gaza, and they are the backbone of the humanitarian response. And any efforts to defund them amounts to depriving Palestinians in Gaza of the essentials needed to survive. The other thing that we want countries to do is to use all the diplomatic tools in their toolbox. We're not seeing that yet. We're seeing a lot of statements of concern. We're seeing a lot of countries say that they're having conversations, but are they actually doing everything that they can to use their leverage? I don't think so. We have not seen any evidence of that. And this is why we have said that countries have a legal obligation to prevent atrocity crimes from unfolding. And we've continued to call on that. We, of course, diplomatic engagement at the Security Council, at the UN General Assembly, this is all important. But at the end of the day, this war is taking place with foreign supplied weapons. And so that needs to be stopped. We try as much as possible to paint a picture of what it's like for Palestinian children on the ground, and what it's like to deliver humanitarian assistance in the most horrific ways possible, and how what's happening is impeding our work. And we've been public about it, and we expect countries to use this to inform their policies and approaches with what's happening in Gaza. And this is what we will continue to do. In terms of the long-term impact on children, I think the long-term impact of malnutrition is straightforward. It will lead to stunting. It will lead to cognitive it will impact children's cognitive abilities. It will impact their physical abilities, and it will make them more susceptible and impede their survival, right? Not just because of the access to food, but also because they're more susceptible of dying from diseases. But other aspects that we haven't really talked about is what it means for their education, what it means for their mental health status. And one thing we don't talk about often, because there's, children in Gaza are facing such horrific challenges, is education. There is a complete absence of education in Gaza. Children will have lost another year of school. And for, if you're 16 years old, you've lost probably several years after, suffering through a, harsh Israeli military blockade, recurrent conflict, recurrent violence. And now we're 6 months into this, and that's almost an entire year of school. Not only that, we've seen over 370 schools too damaged to function or completely destroyed. So even if we were to see a ceasefire tomorrow, children will not be able to just go to school. We would need to see, rapid reconstruction efforts. We would need to see, organizations set up temporary learning environments. Children will need a lot of mental health support to even get to the state where they are able to go to school. Remember, 17,000 children in Gaza at least have lost one or both of their parents. In many cases, children are the only surviving family members. The environment to just return to their lives is not there. In terms of, their mental health, even before October 7th in Gaza, we found that 4 out of 5 children were suffering from nightmares. They were having, or more of them were having thoughts of self-harm. They had no hope for the future. And what parents have told us is that's gotten infinitely worse over the last 6 months. I can read some testimonies that I have from parents that we interviewed over the last 6 months. Let me just, because I think, some of the parents that we've spoken to have really have put it best. Let me just get this out. So Save the Children a few years ago conducted a comprehensive study on the mental health of children in Gaza. And as I mentioned, we found it was just horrific. 4 out of 5 children suffered from nightmares and depression. Even more had thoughts of self-harm. We went back over the last couple of months and talked to parents, caregivers, aid workers, and mental health experts. And what we found is that currently Gaza presents textbook factors for lasting mental harm for children. One mother of 4, told us that she said to us, I wouldn't even say that their mental health has deteriorated. It's been obliterated, complete psychological destruction. Another parent, a dad, told us, quote, my children ask me, Daddy, can we go home? I have to tell them that our house was destroyed, that it's gone. They start crying, and I comfort them by telling them that I'll get them another one. What can I say? I can't see a life for them anymore or a future. Life is so difficult for them now. We live in such a small place. They cannot breathe. The streets are full of children. The whole of Gaza is in Rafah now. People are stacked on top of one another. Sometimes I try to take my children for a short walk, and all they do is cry. What can I do? And so those, that really shows the level of fear and desperation right now, especially even people who've made it and who have survived and are in Gaza and in Rafah right now. What we hear from our staff is that Rafah is teeming with children. There are children all over. It's a city of children. So if there is an expanded Israeli military incursion in Rafah, it's horrifying to think of it, but we may see even higher numbers of children being killed. It's such a small place. People are crammed up up against each other. The streets are lined with tents. They have absolutely nowhere to go, and so we've warned that if there is an expanded military incursion into Rafah, we will see mass casualties possibly on a scale that we haven't seen before, which is horrifying to think of. We may see a collapse of the humanitarian response. That's where most of the humanitarian aid is being distributed. And so what we're seeing now on children will have a lasting impact on them. We talk a lot about the number of children who have been killed, but we don't often talk about the lifelong injuries that many of them face. Even in Rafah, my colleagues say that they walk around and you see child after child maimed with one or more of their limbs missing. I can't even imagine the numbers of children now who suffered from not just explosive weapons that have ripped out their limbs, but also children who are facing amputations without anesthetics, and also no medical support to help them even recover and learn how to live a life without their limbs. This will have lifelong consequences on children. Doctors have said that children are dying with painful deaths. I was at an event the other day, and a doctor was saying that he witnessed a child, her whole face burnt, and you could see the bones, and they couldn't even find a place for her to die. So this is the reality for Palestinian children in Gaza, and it's impossible for this to not have lifelong consequences on them and their ability and future prospects and ability to recover. What we're seeing in Gaza is so unprecedented. I don't know. I can't even imagine what the solutions would be for the 17,000 children who have lost one or more parents. It's Gaza and the occupied Palestinian territory in general does not have currently the capacity to deal with this impact, with these problems, with these issues, and it will have lifelong consequences.
I don't even know what to say. Most of the time when you hear such things, especially when people who have been familiar with the crisis in Gaza, that it was already in the worst of places. It's an open air prison, there's always been a blockade. People have always been suffering, more than half of the population have been poverty stricken and starving and malnourished and struggling with education, and all these night terrors and trauma. It's generational trauma as well. And so, like you said, you can't even possibly comprehend or how to prepare for what is the situation now and what will be the result of it should Israel leave Gaza soon. So yeah, you're just left speechless most of the time. I did have a question in mind when you were mentioning about Rafah, about children running around Rafah, that it's been noted that, like you said, when you look out into Rafah, it's just children running around, children, just laying between these tents as well when I look at these pictures. So Israel talking about invading Rafah soon, they can't not use the excuse anything but that it will end up, should they invade Rafah, it will be systematic targeting of children. even though we see that now, but in Rafah, we'll see that more. So what would you say is the most pressing needs for children in Gaza at this moment? And how can, the concerned international community contribute to helping them, whether it's through other aid organizations or even with the supporting Save the Children's efforts? What can we do now from where we are, where we are not allowed in Gaza? What can we actually do? People who want to do something, what is the most effective method to make them feel that they are contributing?
So I want to say a few words on Rafah, because I think what's important to note here is that there is no possible plan that would protect civilians in Rafah. Even so-called evacuating families to the north would not protect them. Sending them to central Gaza will not protect them. Gaza has been declared uninhabitable. Mm-hmm. And in northern Gaza, the conditions to survive are not there. So to send people to another part of Gaza would not protect them, would not ensure their survival in any way. And we've been really clear about that. And so there's
nowhere left to seek refuge within Gaza.
There's nowhere left to seek refuge. Even previously, I mean, as you said, Gaza is one of the most densely populated areas in the world. There was nowhere for people ever to go, and now in Rafah, they're squeezed into a tiny area without the ability to really the conditions to survive. And so for us, what's most important is still to call for a ceasefire, not just to call for a ceasefire, but to implement a ceasefire. It's now been more than 1 week since the UN Security Council passed this long-awaited, long overdue resolution for at least a temporary ceasefire during the month of Ramadan, and then leading to a lasting ceasefire. We've seen this go ignored completely. And so, but at least there's a framework to say, look, the international community, world's leaders, the body that is responsible for ensuring global peace and security, committed to this. We need to hold our leaders to account. And we also saw the ICJ come out, the International Court of Justice come out with strengthened measures on protecting Palestinian people. So that's also important to note. And so right now it's about holding our leaders to account, holding them to account in terms of our own national laws, right? According to international law. Of course, there are many organizations that people can donate money to, and I think that's important, right? People need humanitarian assistance, and they need anything, anything that comes to the border is helpful, and that's important. That should be supported. But also, and I think the most important thing is for individuals to call their elected representatives, emphasize their expectations, emphasize what their responsibilities are, and what they want them to see, what they want to see happen. And, that's a ceasefire, a respect for international humanitarian law, respect for human rights, aid to go into Gaza, to stop the starvation of the people of Gaza. And this is the most important thing that we can do, irrespective of where we are.
I also wanted to know if you can say something about this, but Save the Children is quite, they're based in several parts of the world, they're quite active. I wanted to know has there been observations made on how other, victims of conflicts and war are treated and responded to around the world, and so between them and between the Palestinians in Gaza, could you maybe point out anything that how the response is different, the lack of accountability, or I guess what do most people remain ignorant of when it comes to Palestinians in Gaza, and their life there and the struggles and the suffering?
Well, that's a big question. But I guess, everyone is paying attention to what's happening in Gaza. Um,
Yeah,
wherever
that's
we
why all
work.
eyes, all attention is on Gaza. And that's why I asked the previous question, because a lot of people say they just feel like they're just watching and they
Yeah.
feel helpless. They don't know what to do because there's so much to do, but there's no quite clear sign of where to start or how to go about it.
Yeah, it's a good question.
So
I think
much learning in one go as well, because all eyes are on Gaza now, and people are learning so much history and just shocked about how much has been going on without them knowing, because whether it's media bias or reporting and whatnot, I guess.
Yeah, definitely. And I think it really depends on where you are, like what part of the world, right? In some places there's more access to information, and other places there's less. I think so across countries that we work in, we are seeing people are paying attention. People are paying attention to how the world is acting. They're paying attention to how leaders are acting, especially Western leaders. And I think people are taking note. I think there is, of course, quite a lot of attention on Gaza, and I think that there are many other crises where the situation is also horrific that are not getting as much attention, and people are also noting that. The situation in Sudan is also horrific. And many other places. I think what people are also noting, though, with Gaza is that even though there is all this attention, everything's out in the open. We're seeing people's deaths live streamed. We're still seeing an unwillingness to take meaningful action from world leaders, despite messages sent from their publics. And so I think that's also being noted. But I think what we have seen, I think it's important to note, is there is global solidarity with the people of the occupied Palestinian territory and in Gaza in particular. I think we saw a lot of this with projections in different capitals, ceasefire now. We've seen people come out and in solidarity. So I think the global solidarity is there. But I think definitely we will see the observations of how Palestinians are being treated in Gaza will have an impact in other contexts. The lack of accountability will have an impact on other contexts, unfortunately. And this is why it's important for us to continue to call for accountability, to continue to ensure that we don't see double standards applied, that we see a respect for international humanitarian law. This is why it's important for organizations to continue to speak out about what's happening, and use their presence on the ground to speak out. And this is what we'll continue to do.
Well, thank you, Alex. I think you've been so fruitful that you've addressed everything. But there's something you noted, I just want to ask one last question, that the long-term damage and implications that's going to be left for the Palestinians. So people are so concentrated on what they can do now, isn't it? It's the here and the now and whatnot. But what are the different ways people can get involved later for the children in Gaza once hopefully a ceasefire is called and this is over soon? How can people remain active for the children and the rest of the victims in Gaza?
Well, even if there is a ceasefire, we know that the situation will still continue to be just absolutely horrific. And so I think it's important for people to continue to share stories, stories and information. Awareness raising from reputable sources is important. And so that's definitely something that people can continue to do. There's always volunteering. There are many organizations that are providing medical assistance to Palestinian children who are going to be on the ground working with children and families. I'm sure there will be volunteer opportunities. I mean, I'm thinking like way down the line. Of course, people can donate in the future. But also, I think irrespective of, I mean, eventually there will be a ceasefire, but I think it's important for individuals to continue to be engaged on this, to continue to remind their elected representatives that they're watching what's happening, and that they expect, their governments to act in accordance with international law and stop fueling the crisis. And that will sadly continue to be an issue, I think, for some time to come.
Mm-hmm. And how do you think is the best way to mark Palestinian Child's Day? How can we celebrate yet mourn for the children right now?
I think Palestinian children and the deaths of Palestinian children are not numbers. And I think to an extent we've become almost desensitized to, we're seeing another 100 children killed. And so it's important to also commemorate the lives of Palestinian children and emphasize that they all had lives, they had families, they had loved ones, they had hopes, aspirations, dreams, and that needs to be noted and commemorated. And we need to remind people of that always. And I think that's the most important way of commemorating this day, and also using it to remind elected representatives what their actions are doing to Palestinian children who had hopes and dreams and futures that are, and how they're contributing to having those robbed from them. And that's how I would say we need to mark Palestinian Children's Day.
Thank you so much, Alex. I really appreciate the time you gave today. And thank you for to our listeners who have joined in. And please continue joining us for the upcoming Memoing Conversation with episodes. Thank you.
Thank you so much. Thanks for having me.
This was Middle East Monitor Conversations, brought to you by the Middle East Monitor in London.